Bryson DeChambeau just had hand surgery. What does that mean for his career, and when will he return to play golf competitively? In this video, you're going to get that perspective from a physical therapist and a golf fitness specialist. During the Masters, it was revealed that Bryson has been dealing with an ongoing left hand and wrist issue that has been plaguing him for a while now. And it was just announced earlier yesterday that Bryson will undergo surgery. As you can see here, he is finally and successfully in recovery from surgery right now. Before we get into what his injury was and what the surgery that he had done, let's talk about how he experienced this. Last fall, he experienced a slip and fall on some concrete, landing on his left hand, supposedly felt and heard something pop. He most recently irritated his left hand and wrist when at the Saudi Invitational, he was playing some ping pong actually with Sergio Garcia and Joaquin Niemann, and they were playing on a recently cleaned marble floor, and he accidentally slipped and fell onto his left side. He was having so much pain and difficulty that he was having a hard time gripping the club. He had met with some doctors at that time who advised him not to play or do any serious training for the next 4 months. However, returned to competitive golf within 2 months. The injury that Bryson has been dealing with in his left hand and wrist is an injury to the hamate. The hamate is located in the wrist, pretty much right here in the hand as you follow down the pinky finger. What makes the hamate so interesting is that there is a bony projection that protrudes from it called the hook. We know that Bryson had a fracture of that hook. We do not know exactly what Bryson had done in surgery. However, when it comes to an injury and a fracture of the hook of the hamate, there are pretty much two surgical options. The first one being a removal of the bony projection and or any other parts that are in the area, or fixation with some hardware, including some very small screws and some wires. So overall, what does this mean for Bryson's timeline to return to play and his overall career? Initially, Bryson is going to be immobilized in some sort of cast or splint. Again, it's kind of hard to see from this picture here, but you can tell that he is in a splint that's more for just keeping his arm still, but we do not see what's underneath that. During the first 2 to 4 weeks, he's really going to be focusing on reducing any kind of swelling, keeping his shoulder motion, keeping his elbow motion, keeping his forearm motion, and as best as he can, keeping his finger motion. He will most likely not start any kind of resistive or strengthening exercises until about 4 to 6 weeks post-operatively. Specific strengthening exercises, obviously, for his hand, his grip strength, his fingers, and his forearm. Athletes to his caliber return to play without any complications. Most studies point to athletes returning to full play around 8 to 10 weeks. So that does mean he will most definitely be out for the PGA Championship, and he's going to be cutting it very close to returning to the US Open. Overall, I think Bryson will be able to return back to his prior level of play without any complications whatsoever. I would love to know what any of your thoughts are on this situation. Please feel free to leave any comments and questions down below in the comment section. And if you found value in this video, I would really appreciate it if you hit that like button. And if you want more videos like this and more videos to improve your own golf game, make sure you hit that subscribe button as well. Both of those actions really help me and the channel out, and I truly appreciate it. Other than that, let's hope Bryson has a speedy recovery and we see him back out on the course very soon.